Hello, everyone, and welcome to the information session for the 2021 Roche Diabetes Care Innovation Challenge. I'm Stephen Collins. I'm the CEO of Matter. Matter is a healthcare technology incubator and innovation hub that's built on a belief that collaboration between entrepreneurs and industry leaders is the best way to develop healthcare solutions. This is the second year that we've partnered with Roche, which is one of the leaders in diabetes care with a portfolio of products to support people living with diabetes. This year, our focus is on the following question. How might we better monitor the severity and progression of associated complications and comorbidities and actively manage and intervene in order to slow, stop, or reverse the progression of these risks and promote a better quality of life? As I mentioned up front, we believe in collaboration. We believe that the best solutions to improve health can be found when entrepreneurs are collaborating with industry leaders like Roche, that the complexity and nuance of healthcare is such that the closer entrepreneurs and established companies are working together, the better and more successful the solutions will be. Last year's Innovation Challenge identified 4 companies to collaborate with Roche, ranging from commercial stage partners to early stage R&D collaborations. And we are delighted to be working together again. For the first half of today's program, 3 experts will join us to discuss minimizing, managing, and transforming risks associated with diabetes complications and comorbidities. And then after the panel, there will be an information session to dive deeper into the Innovation Challenge itself. Guiding the conversation today is Arun Bhatia. Arun is the Open Innovation and Startup Engagement Lead at Roche Diabetes Care, but more importantly than that, he was previously Matter's Director of Partner Engagement. He led strategic program design and supported our partners' innovation efforts, and it is always great to be on a stage, virtual or otherwise, with Arun. Our 3 panelists today are all experts in diabetes care, bringing both the corporate innovation and clinical perspectives. Jörg Hölzing is the Global Head of Strategy and Customer Solutions at Roche Diabetes Care with responsibility for the business unit, data, ecosystem strategy. He leads the full hardware and digital solution portfolio development and global marketing for the business. Stephen Ranjan is the VP of New Product Development at Roche Diabetes Care. He's responsible for developing strategies and driving digital innovation focused on meeting the needs of healthcare professionals and people living with diabetes. And for the clinical perspective, we have Dr. Jennifer Green, who is a professor of medicine in the Division of Endocrinology, Metabolism, and Nutrition at Duke. She's a faculty member of the Duke Clinical Research Institute and a longtime chief of the endocrinology section at the Durham VA Medical Center. So with that, thank you all for joining. I will turn it over to Arun to lead today's conversation.
Terrific. Thank you, Stephen. Appreciate the introduction. Delighted to be partnering with you and the Great Matter team on this challenge again. Good morning, afternoon, evening to all of you who are out there joining us today. Hope everybody's staying safe and healthy and hoping to see the light at the end of the tunnel of this pandemic year. As Stephen mentioned, I'm Arun Bhatia. I do serve as the Startup Engagement Lead within Strategic Insights and Open Innovation team here at Roche. That's led by Marco Di Polo, who many of you may know as a mentor there at Matter as well. We, along with our franchise colleagues here at Roche, are really excited to build off the success we had last year with this program. And Stephen mentioned launching the second year of this Roche Innovation Challenge. Really looking forward to engaging with all of you again, the startup communities, the innovative entrepreneurs who I personally know are working tirelessly to make really a true difference in the health and lives of people. And having worked with all of you in the entrepreneurial community, I personally have a very strong appreciation for your mission-driven work and passion. And we at Roche are incredibly inspired by that commitment as well, which is what brought us back to this challenge again this year. And we're really excited about the opportunity to combine our capabilities and our energies to deliver meaningful value back to patients, back to the healthcare system. So thank you again for joining us today. The agenda for this morning is fairly simple. We're going to spend about the first 45 minutes or so discussing our theme for this year's challenge, tackling diabetes-related complications and comorbidities. And through our fireside discussion, hope to share some perspective on the 3 tracks that hopefully will provide you all some insight as you prepare and hopefully submit your applications to the challenge. We'll then spend about 15 to 20 minutes discussing some logistics around the challenge itself and wrap up answering some questions that you all might have. I believe we're taking questions through the chat feature in Zoom, so please add your questions there. And then lastly, we're going to be recording this session to make it available for everyone's listening pleasure later on as well. So with that, I want to welcome our participants to sort of the virtual stage. Jorg and Stephen, feel free to unmute and turn your videos on. Welcome. Thanks for joining us. And I'd like to maybe start with Jorg to have him kick us off to introduce himself, and for those who might be learning more about Roche, perhaps share a high-level overview of Roche and our business areas.
Sure. Thanks a lot, Arun. Thanks, Stephen, for the kind introduction. Thanks, everyone, for having me. Pleasure to be here today. As said, my name is Jörg Hölzing. I'm located in Basel, in Switzerland, and I'm together with my team leading the strategy and customer solutions team. So we basically are responsible to develop all the solutions we offer in the area of diabetes within Roche. Roche is a global pioneer in both pharmaceuticals and diagnostics, with a very strong focus on advancing science to improve people's lives. We are the world's largest biotech company, lots of differentiated medicines in different disease areas such as oncology, immunology, infectious diseases, and also diseases of the central nervous system. And we are also the world leader in vitro diagnostics and tissue-based cancer diagnostics. And as part of the diagnostics division, we in Roche Diabetes Care, we are also a front runner in diabetes management. We have a long-standing history of more than 40 years. We have a great team of around 5,500 employees worldwide in more than 100 countries. And together we work very hard with our partners out there in the healthcare systems and people with diabetes to really support people with diabetes, the caregivers, and also the healthcare professionals in the daily tasks around diabetes management. And our overall aim as Diabetes Care, Roche Diabetes Care, is to offer truly integrated and personalized diabetes management solutions, because we really want to enable patients to master the complexity of that disease, and with that also to support the transformation of the healthcare systems to provide more sustainable care and more efficient care. Our portfolio is very large. It comprises hardware solutions in the area of glucose monitoring solutions, insulin delivery solutions, and also a broad portfolio of digital solutions, both for people with diabetes and for HCPs. And I think what makes us unique and what we are really driving very, very strongly, because we really believe in it, it's tapping into an area that Stephen Collins in the beginning covered around the matter of collaboration. We really drive and are very strongly behind the idea of an open ecosystem. So that means that we are working very hard to be able to connect different devices, digital and hardware solutions in the market, to really offer a holistic view of a patient to the patient or to the healthcare provider in order to get better insights, a better understanding of the disease and the very situation, and with that hopefully leading to more personalized and effective therapy adjustments. That is a journey we started 3 to 4 years ago, and the journey we go together, of course. We collaborate throughout the globe with thought leaders, with patient associations, caregivers, healthcare providers, and payers. And ultimately also, of course, with Matter, which is this year's 2nd edition. We started last year, and it was a really great experience. Arun also mentioned that earlier. And that's why we are super thrilled to be here today again with all of you. And I'm looking very much forward to getting to know more of you and tap into all your great ideas and talent to bring solutions out that bring true relief to patients with diabetes. Thanks.
Wonderful. Thanks, Jörg. Dr. Green, welcome. Thanks for joining us. As you also share a brief introduction of yourself, wanted to maybe get your initial thoughts. Maybe you can frame for us at a high level, kind of the impact as we get into our theme this year, the impact of diabetes-related comorbidities and complications and the importance of focusing in on that area.
Sure, thanks. I'm Jennifer Green. It's really a pleasure to be here today. I'm an endocrinologist at Duke Health and at the Duke Clinical Research Institute. I've been at Duke for about 25 years, and really the focus of both my clinical care and the research that I've done during that time has been on reducing the risk of serious complications in people with diabetes. And essentially what that means is looking for strategies and ways to help people with diabetes live long, healthy, and active lives. And it sounds simple, but it really isn't. It's a complex disease. People with diabetes are taking lots of medicines and often have many other associated medical conditions that they have to manage. And so that in a nutshell is the challenge, and is how to coordinate the care of all of these issues that people with diabetes have, again, so that they can stay healthy, so that they can stay off of dialysis, so that their vision is preserved. Really, at the end of the day, that's what we're looking to do. And we're looking for ways to make that easier for both people with diabetes and their caregivers. People with diabetes see doctors fairly often, but diabetes care is really in large part in the patient's hands. And it's very much dependent on how they live their lives every day and the choices that they make and the support that they have in making the choices that are best for preserving their health over the long run. So it's no small feat. Diabetes care under the best of circumstances is challenging, hard to coordinate. And unfortunately, in the setting of COVID, has become an even greater challenge. We know that people with diabetes and similar chronic conditions are not seeing their caregivers with the same frequency that they did prior to the COVID pandemic. And we don't really understand the impact of that interruption in care yet, but it is unlikely to be a positive impact. So we all really need to think about ways to really help people stay connected and to care for themselves and communicate with their care providers in this new world and new setting.
It's a great framework, great setup for the conversation, and we'll talk in a little bit more detail on some of the specific challenges. So thank you for that. Stephen, welcome. Could you also share a brief intro and some of the objectives of your franchise and the work that you're doing?
Absolutely. Thank you, Arun. And thank you to also Dr. Green for joining us here today. As Arun mentioned, my name is Stephen Ranjan, and I lead our franchise that's focused on primarily our digital offerings, both geared towards patients as well as healthcare professionals. And we as an organization are really excited to be back here working with Matter and working with the startups, because at the core of the issue, I think we're really looking at how do we help people with diabetes not just focus on, one or two aspects of their condition, but really be able to look at everything, because each aspect needs a certain amount of effort or focus depending on where they are in managing their condition or the disease. And I think this is why we this year focused very specifically on complications or comorbidities. And as Dr. Green mentioned, especially in the context of COVID, some of this is going, under, screened or underdiagnosed because of the context we're in. And one of our objectives as an organization is how do we play a role by working with within the healthcare ecosystem to really tackle some of these issues? How do we find new ways of approaching these? What are new strategies or ways to kind of pick up the fact that someone needs more attention because a particular complication or comorbidity is progressing much faster and we need to give them that kind of proactive outreach. And this is where I think the startup community comes into play. You've got a lot of ideas. We've seen this last year in our first challenge, a lot of great ideas. And what we're looking to continue to expand on is, how do we bring those ideas? How do we work together? Not just with Roche as an industry partner, but also with partners in the field providing care. And that's why we have, pleased to have Dr. Green with us here to share her perspectives. And I'm excited to see how we wrap up this year's challenge as well. So thank you, Arun, for facilitating this, and looking forward to a good discussion with my fellow panelists.
Terrific. Thank you, Stephen. And I think tackling comorbidities and complications, as we're hearing, is an important part of the entire diabetes management solution. So it makes a lot of sense that our franchise and our businesses are really focused on this. Want to spend the next few minutes diving now into some of the specific tracks that we have for the challenge. And apologies, I'm going to go a little bit out of order to capture some interesting points. But really want to actually piggyback off of what Jorg and Stephen had mentioned about this focus on the patient and some of the challenges that they are having in terms of managing not only multiple complications and comorbidities, but concurrently along with diabetes. So Jorg, I might maybe ask you to just kick us off. And you talked a little bit, and hoping you can elaborate a little bit more on that IPDM vision that you talked about. How does that actually help empower patients who are managing several chronic comorbidities? Why is this an important area for us?
Sure, thanks, Arun. And also from my side, a big thank you to Dr. Green for joining us today. And I think you made a very important point, which is the topic of how much time a year people with diabetes are basically on their own, right? Despite seeing doctors quite often. I think in average, we say less than 5 hours a year, a person with diabetes is with a specialist. That means the rest of the year, he or she is on itself. Yet he or she has to take several, sometimes up to 20 or 30 different therapy decisions a day, a single day. And for each of that therapy decision, you need to incorporate lots of different signals to take into consideration. How much insulin do I still have on board? How much carbs does the food I'm going to eat have? Am I going to do activity afterwards or not? Am I sick? How was my sleep? So lots of different factors really to take into consideration. And we just see that this is a very overwhelming and sometimes also very complex task for a lot of people out there. And we really believe that in order to support people with diabetes here and also support healthcare professionals to be able to have better data when making therapy decisions, we need to bring all these different data points together that have an impact on or the onset, the progression, or also the immediate adjustment of diabetes. And this is true for the very core topic of diabetes management, but of course it goes beyond and taps into all the comorbidities that we spoke about earlier. And hence we really believe in this open diabetes ecosystem. We really believe that it should be allowing and supporting people with diabetes to bring the different devices, the different solutions into one place, combine the data, and empower the very person to take the best situation in that very moment. I think that is the core of our approach. That is a journey we started on 4 years ago, and where we're making good progress right now, and where we really believe we can help both patients and HCPs.
Right. Dr. Green, same question maybe from your perspective. What are some of the specific challenges maybe you're seeing at the patient level, at the provider level, as they are trying to manage multiple comorbidities?
One thing that I do want to take a moment to say is to make sure that we approach this in a positive way, because with respect to diabetes-related complications, we have very, very powerful tools to intervene and reduce the risk of serious complications for people with diabetes. And the focus is on identifying the risk of complications or presence of complications early and making sure they're addressed appropriately. So I just want to make sure that at least is introduced into the conversation, that it's not just a matter of knowing that something bad is going on and watching it over time. We really can intervene and very effectively keep people healthy. But part of the problem with diabetes management is that, number one, care providers and people who are prescribing medications or interventions need data in order to make sure that those interventions are as safe and effective as possible. And so sometimes it's an absence of data that's the obstacle. On the other hand, some patients are collecting a great deal of information at home, and it can be very basic information like, did I take my medicine on a regular basis, weight, blood pressure, blood sugars. But the problem can be that if that information is, for example, left at home or left in the car, which is very common, the care provider never sees it, or sometimes the care provider doesn't really have the time to really access a tremendous amount of information that might be available. So those are all lost opportunities to make effective interventions. And I think really represent areas where there could be significant improvement. So if data like that can be accessed more readily, and if it could be packaged in a way that the care provider could use to make quick and effective decisions, I really think that that's an opportunity that we should think about and represents sort of a day-to-day and moment-to-moment challenge in caring for people with diabetes in clinic. I hope that answers your question.
It does, and I appreciate the viewpoint around, that's why we talk about empowering patients, right? It is actually trying to make it a more positive, more high quality of life experience, and understanding how best we can help patients empower themselves to address some of these challenges. We do often talk about patients who are on a path towards a complication. So one of the, as we talk about retinopathies, as we talk about kidney disease, there's sort of a path that patients are on. Some, as you mentioned, are early on in that stage. And if we have an opportunity to intervene early, that's great. Some are further along, some are towards the end of that path before that disease, or before that risk turns into a full-fledged disease. Dr. Green, I'll stay with you on this one for a second, but as you think about some of the then interventions and treatments that happen along that pathway, again, just from your perspective, what are some of the treatment challenges that you see with patients along their risk progression?
Well, one of the things I'd like to mention about complications and risk of progression of complications that makes diabetes care so challenging is that often evidence of organ complications or eye complications can be present, but the patient or the individual, him or herself, doesn't feel bad, doesn't notice anything. So they're unaware of this and they don't really necessarily think about it on a day-to-day basis or have it register as a problem. For example, that they have early changes in their eyes related to diabetes, or they have a little bit of protein in the urine, which would indicate some kidney damage. But those are really the stages at which we want to identify those problems early, refer them to appropriate specialists, make sure they're on appropriate classes of medications, have their blood pressure, blood sugar as well controlled as possible, because we know that that will significantly alter their trajectory over time for the better. And it is completely possible, even in people who have sort of modest or mild complications, where it is possible to keep them at that stage for very long periods of time, and they don't have to have significant worsening if the intervention is introduced early. But it is a matter of, number one, understanding that the evidence of those complications is there early, and B, getting everybody to take it seriously. And it's not just the individual with diabetes, but it's everyone in their orbit, who's providing care, prescribing interventions, and probably their family as well. It's a shared responsibility.
And Dr. Green, I think that point around, that evidence that the condition exists, I think is a key point. It goes back to the comment you made earlier, identification. And then I think from what we see in the space of diabetes, I think we have to find ways to support not only the individual or their family member in identifying that we need to seek help, but we need to have a conversation with our either a family physician or our specialist that we're meeting, but then also helping the clinician to be able to know this is what happened and we need to maybe pay attention. So I think that importance of really kind of surfacing that it exists, but then also equipping the right stakeholder to say, okay, I need to seek out help, or I need to change course, becomes a key aspect. And I think that's one of the challenges we see just in our industry at large, is we have this information, but it is not aggregated well. And so then we're not making the data actionable, or the diagnostic is not being translated into an appropriate treatment. And I think this is where the opportunity exists for us.
Yeah, terrific. And maybe just along those points, as we think about treatment for some of these complications, Dr. Green, again, from maybe the physician perspective, also, you mentioned sort of the tools in your arsenal. Talk a little bit about maybe some of the challenges of where those tools are. What are there any particular areas that are, I'll say, deficient or in need of innovation or opportunities where you see we can be doing a better job as a whole in terms of innovating around treating those complications?
Well, there are probably an enormous number of such opportunities or sort of gaps in care delivery. But one of the areas that comes to my mind pretty quickly is how quickly the guidelines for diabetes care have changed and how much they change on an annual basis. And the majority of diabetes care is delivered in the primary care setting. It is not delivered in the United States by endocrinologists. Endocrinologists probably only see about 15% of people with diabetes in the US. So this is largely the responsibility of general medical doctors. Some people with diabetes are more likely to see a cardiologist, a heart specialist, or even a kidney doctor than a true diabetes care specialist. And so those individuals may be a little bit less familiar with the guidelines for diabetes care that are, really very familiar to endocrinologists who sort of exercise those care guidelines many times a day. And so to a certain extent, it's awareness of evidence-based guidelines that can be an obstacle to implementation of effective therapies. So that's one thing that comes readily to my mind, is just awareness and the ability to make quick decisions so that people are treated as quickly as possible with interventions that are known to be effective and reduce their risk of serious complications. And again, that's sort of the implementation issue that is such an issue related to both diabetes care and many other medical conditions. So that's one area, but it certainly doesn't represent sort of the full spectrum of things that could be improved upon.
Sure.
Yeah, absolutely. I think that's definitely something we've seen even in our research in this space. That's definitely a gap. And I think a similar challenge also exists on people that are managing the condition themselves, is in terms of how do you put all of this information together and make sense of it. And I think you touched on this, right? The number of data points that you have to kind of think about. Yeah, and I mean, maybe Dr. Green, you have a perspective from the patient's point of view, but we've seen this in some of our research as well, is especially when you're earlier in the disease progression and you're not aware of some of the kind of the severity or the symptoms, it's a silent, the day just passes by, you don't realize it, you're paying attention to things that you heard from your physician, but you don't uncover it. And I think this is where also I think we have a huge opportunity. How do we equip, with some of the advances in technology, with some of the new diagnostic capabilities, how do we equip, people with diabetes to have, or their family member to provide that, identification and say, okay, I do need to do something differently. I do need to pay attention to this aspect of my care plan that was given to me. So that, so it's interesting that I think the challenge is on both sides of the, coin, if you will. And I think it's our obligation to figure out, how do we make it simpler? How do we make it easier to get to that next decision point?
Mm-hmm. Yeah, great point. And that actually kind of leads us into the last track of our are challenged. One, you can't necessarily talk about treating complications without making sure we understand this awareness issue or this monitoring issue of, how do we take patients at an earlier stage, do a more effective job of sort of monitoring the progression of their risk. And so maybe just to elaborate a little bit more on that point, curious from a monitoring perspective, we've talked about empowering patients and obviously empowering physicians as well in terms of building their awareness. But as far as some of the needs in monitoring some of these comorbidities and complications, where do you all see some of the biggest challenges or hurdles specifically related to the monitoring piece?
I think if I may start, Stephen mentioned a very good point, which is it's still not easy enough and convenient enough by large to make that. I'm speaking here of personal experience, being a caregiver to a little daughter that suffers from a rare chronic disease, which also requires 24/7 support. And I have certain parameters I'm tracking. Yet it's impossible because there's still not a viable commercial solution in the market to bring those different data points together. First in my own house, and then second, so it's a high effort. It's paper-based mostly, right, or self-written Excel sheets. And then even if I bring it to the doctor's office, and it's not a GP setting, it's a specialist setting, his program again is not working with my data input. And then most of the time he wouldn't even look at my data, which frustrates me big time. So I think it's this, even if you do the effort, then you have the frustration part of maybe the other side not being able to use it properly. So I think making it as easy as possible to integrate it in a person's daily routine, and less hassle, less a hurdle of using it. And that also, I think, reflects back to what Dr. Green said, the fact that most of patients with diabetes are being seen by GPs. I mean, the GP setting is per se an acute care setting, yet you go there with a chronic disease. So I think also here, when we think in our partners on the HCP side, how can we make the solutions as easy as possible to provide as much meaningful information as needed? I mean, this is for me the starting point of all of it, because if you cannot surface it, because you cannot gather it and bring it together, you won't be able to tackle those challenges early on when they are still by and large preventable, or can at least be taken further out. Yeah. That's for me the key thing on the whole monitoring side.
If it's okay for me to jump in, I completely agree. One of the things about diabetes is it's almost like the individual has another full-time job on top of everything else that we have to deal with in our day-to-day lives. And if we can make that job easier, and in a sense, a bit effortless, at least part of it, that would be incredibly helpful. And it could be small things. It could just be remembering to take their probably many medications at the correct times. This doesn't have to be a tremendously ambitious intervention that could really meaningfully impact people's day-to-day lives and make them better. So I think there are lots of different ways that this could be approached to simplify and again introduce a little bit of effortlessness and effortlessness on the part of all of the team partners who are involved in the delivery of diabetes care. One of the things that's been really challenging from a physician perspective in the setting of COVID, and I personally would appreciate some help with, is really figuring out how to get people's laboratory data, readily available when they're not coming in for clinic appointments. And I will tell you, I don't know if we'll have the answer as part of this challenge, but that is a very significant obstacle to both monitoring and appropriate delivery of care in the pandemic setting for both clinical care and clinical research. That's been a tremendous struggle. And so I would say that's kind of a new problem that I don't know that there will be an easy solution to, but that, that's one area that on a day-to-day basis really impacts my ability to deliver effective care. So just putting that out there as a definite need.
Yeah. I mean, I think definitely agree with the points made, and maybe an area that I see, at least on the digital health side, that we also need to kind of emphasize is, there's obviously new ways and new techniques that we're able to introduce with the digital tools. But I think it's equally important, especially in the healthcare context, for us to also pay attention to the, I'll use the term efficacy, having the evidence to say that it is effective when we deploy it, because I think that is something that in healthcare we do need to pay attention to, and we have to take the time to invest. So that would be an area that I would also call out, that, when we pay attention to monitoring techniques, we're also paying attention to how effective it is and how is it driving that outcome. I don't know, Dr. Green, if you've got anything from your lens in terms of the current challenges with that, but I know for us, that's a critical aspect to focus on, is how do we ensure we're bringing, not only, safe and usable products, but they're ultimately effective in driving the outcomes.
Yeah, I think just to kind of boil that down, we don't want to introduce something extra that has to be looked at, an extra task that has to be accomplished, unless it is clear that an outcome, a desirable outcome can be derived from that activity. So I completely agree. We don't want to just add more work.
Yep.
Makes a lot of sense, and we'll talk in the latter half of this program. The goals of our challenge, our incubation phase or accelerator phase, is exactly to do that, is to help our startup to generate that type of evidence. And so we'll talk a little bit about that process in a little bit of detail. Stephen, just one last thing, just on a point that Dr. Green mentioned, maybe from a franchise side, talk a little bit about, she talked about this connection between sort of patient data and the clinician or the healthcare provider. And I know from a franchise perspective, an areas is that better connection between the provider and the patient. Maybe just share a little bit at a high level, sort of our focus or the franchise focus on ensuring that we have that better connection between patients and providers.
Yeah, happy to do that. I mean, I think we actually touched a lot of it on in the discussion. I think one of it is kind of the basic, data sharing and the data connection that needs to happen, to address, the challenge that Jörg mentioned with his own, personal scenario, or the frustration that Dr. Green, expressed with, you have this information, but it's not made available to view. So I think there's a fundamental, and, you can almost think of this as part of the plumbing of our healthcare ecosystem, and how are we all kind of fitting into that? How do we play with the EHR systems that are in the clinician's workflow? How do we fit into the tools that a person with diabetes and their family members might be using? And so how do we make sure all of this, so that is one aspect. But then the next layer is, how do you then translate that to kind of, fitting into the actual care plan that the individual is on. And then this requires really understanding a little bit more about kind of where they are in their kind of, stage of the disease and how they're being cared for. And so I think that's an area where we're focusing a lot on, is how do we fit into that, and what are the right ways for us to make sure that we're either identifying tools to help maybe surface kind of a different, care plan or a care pathway that needs to be defined, or more kind of, as we just discussed, the monitoring of certain kind of markers, because it is important to pay attention to that a little bit more frequently. And then, I think ultimately, leading to that kind of empowerment that we are all looking for is, how does the individual feel the confidence that I don't need to be worrying about diabetes 24/7. I can enjoy my life. I can be thinking about my son's graduation or my daughter's wedding, and those are things that can consume their mind, and diabetes is sort of under control. So how do we kind of pull all of these pieces together so ultimately the person with diabetes is enjoying that true relief?
That's great. That's a great summary. So I hope folks on the call are getting a little bit more color and context into kind of this challenge theme, really focused on alongside diabetes itself. How do we empower not only patients, providers, supporters to manage their comorbidities? How do we do that in a better job of monitoring that and treating those things, not only with tools and technologies, but processes and intervention pathways that are easier for folks. So hopefully, again, that gives a little bit of color to folks in the audience who are submitting their applications. Want to leapfrog off of a point that Stephen had brought up in terms of the evidence generation and the outcomes and the value. As we kind of wrap up our discussion here, as I mentioned, we're excited this year to be working with Duke Clinical Research Institute that has a really strong capability in serving as a test bed and potential pilot site for startups that will emerge from this year's challenge. And that kind of test bed can be a great platform for evidence generation as startups look to pressure test and validate some of their hypotheses and assumptions. So maybe a question for Jörg and for Stephen, this type of capability, the ability to test these types of solutions sort of quickly, talk a little bit about that, the strength of that capability as part of our open innovation efforts with startups and what that means to us.
I can start, Stephen, and then maybe please add. So I think overall, based on all the topics we have touched so far, it's obvious that meaningful change in healthcare can only happen if we really collaborate and collaborate between the companies that develop new solutions, the people affected by the disease, but ultimately, of course, also the healthcare providers. And this is why this partnership is so exciting to us and to me, because I think it really gives us a great opportunity to connect patients and providers in order to also limit this type of comorbidities or capture them earlier on and really provide solutions that help on that side. And on top, I think working with all those startups that might join us here in the challenge will also help us to really bring a very different view on different opportunities or solutions and innovations to the space. And then we could figure out which one best fit, that setup that we have here and the opportunity in piloting it with Duke. I think so. It's a great opportunity to bring the three most important parties in that journey together to really change.
Yeah, and I think what excites me, and as I reflect on our kind of year 2 of this type of a challenge, and I think I'm sure every startup that is listening to this webinar, has probably received this question when they are talking to a payer or to a clinician, who's a champion in a health system, like where's the evidence, where's the data to back it up? And we see that as a need, especially as we look at kind of digital and digital tools emerging or novel diagnostics emerging that you need to combine with the existing system. And I think this goes back to how do we find the right ways to put the pieces together, because the end goal should be to reduce the waste that we see in our healthcare system. And I think Dr. Green mentioned that. And I think that's really what's exciting is how do we shape that together? Because I don't think there's one entity in the ecosystem that can solve this. And I think that's really, for me, the ability to kind of work together, the ability to shape it, to learn together. Those are the things that excite me.
Terrific. As we come up on time, one final question for all of you, actually, as just sort of a parting message to innovators, entrepreneurs out there who might be listening to this, considering submitting their application, thinking about working with Roche. Any sort of thoughts to innovators or things for them to keep in mind as they put together their applications, as they put together their stories? Any thoughts, suggestions, comments that you would have them pay attention to or keep in mind as they share their story with us?
I'm happy to go first, if that's
Sure.
all right. I think we've really done a good job in sort of outlining things in broad strokes. The one thing I'd like to add while we still have time is that outcomes can be all kinds of things. And outcomes don't have to be as dramatic as preserving someone's kidney health. Outcomes can be related to patient satisfaction. Outcomes can be related to, adherence to prescribed medications. So it's okay to think about outcomes in an accessible way. So I would encourage thinking outside the box and don't. It's easy sometimes with diabetes care to feel overwhelmed. Trust me, but we all need to kind of chip away at this because we will all benefit. Thank you.
I would add on that one from our point of view. I'd say, whilst we of course want to get to great solutions, I would say don't maybe search for that gold nugget out there, but rather try what could you do at the intersection of combining different already existing solutions. Back to the point earlier, don't introduce new stuff that adds a new process and more work to everyone involved, but rather how could you in a clever way combine existing or pre-existing parts of a solution to a new one that increases patient satisfaction or outcome, as Dr. Green just mentioned. And here I think you have great opportunity by participating in that program, and it will also be a great opportunity for you to receive great feedback from our coaches in the program. So come and join us.
And I'll focus probably more on, I'm sure, which is top of mind for all startups that are interested to figure out how they make the cut in this challenge. And I would say, focus on the person with diabetes, right? Put that at the center of everything you're doing. Really understand and empathize with them. Make sure you can really articulate that pain that you're trying to tackle, and bring that to life in your application process, in the presentations that you would be doing. But focus on that, and then take all of the information we've given as context. But if you, I think, stay focused on that and bring to light, I think, the great ideas will surface from there.
Terrific. Great feedback. And yes, we'll talk in a little bit more detail about some of the criteria that we'll be looking at and share a little bit more about what we'll actually be doing during the incubation phase, during the accelerator phase. I think the high level message here is that, we're not expecting or asking folks to come to the table with every answer, with every question answered. We recognize this is a process, and we kind of want to be at the table, roll up our sleeves with you to help answer some of these questions and figure out again how we can combine, our energies and our capabilities to really add value into this process. But I hope this conversation, albeit I know it was at a very high level, but hopefully it gave you some perspective on some of the challenges that we're thinking about, the challenges that physicians face, that patients face. And again, going through this program with us, we'll have more opportunities for sort of detailed discussions like this that entrepreneurs can take advantage of. So Jorg, Dr. Green, Stephen, thank you very much for the time and for the insights. That's terrific. Appreciate the time. And I will now turn it over to Gina at Matter, who will kind of transition us into the challenge logistics, and we can talk in a little bit more detail there.
Hello and welcome, and thanks for that absolutely dynamic conversation. I think it's the perfect setup to dive into details about the 2021 Roche Diabetes Care Innovation Challenge. First of all, I'll encourage everyone who has not yet done so to visit matter.health and our challenges page. You can navigate to it from the homepage or matter.health/challenges. We'll put that up at the end of this session. But I'll start off with just revisiting what I think Stephen Collins opened the program with, and that we've touched on throughout, which is, really what is the overarching challenge statement? And you've heard it over and over again, and it's about tackling diabetes-related comorbidities and complications. But I think what's significant here is the bottom part of our challenge statement, which is, how do we actively manage and intervene to slow, stop, or reverse? And really with the goal of having better quality of life. And I think everyone on the panel today really underscored, there's really a number of different ways we can get there. With that said, there's 3 tracks that we're looking at. Again, I'll kind of go over them at a broad level, but invite you to analyze this. The first track is really around more effectively monitoring progression and risks to delay or stop. And some of the kinds of interventions that or solutions that we're looking for are monitoring solutions, digital biomarkers, patient or physician engagement solutions. So this may be you. The second track is really around empowering people with diabetes and their providers. And I would also say, maybe as an extension of that, caregivers, to proactively manage multiple and concurrent diabetes-related conditions. So here we're looking at engagement solutions. So some of this might be tools, this might be platforms, this might be what Jörg was saying about a way to neatly stitch together existing opportunities or dashboards to create a more fluid experience for these patients and providers. And then track 3, which is targeted interventions. How can we do this more efficiently? How can we do this smarter? That really look at slow stopping or I think ideally reversing progression of diabetes-related complications. And here we're looking for digital tools or interventions. And I think there are many different ways that could look. Engagement solutions, AI solutions, population risk assessments. So there's a lot of, I think, opportunity here. And this goes back to, I think, something that Dr. Green said in her comments around, data being a very key component about how people are doing decision making and how we might be able to access some of that in a different and novel way. So these are the 3 tracks that we're looking for solutions. If you have something that bridges them or incorporates components of each, that's still a great fit, and we'd love to see your solution. Let's talk a little bit about the timeline. The program opened April 7th, and our submissions will close May 6th. You see us with that little blue flag here today with this information session. It has been recorded, so you'll see it on the Matter site, and you'll receive a link to it after the fact. But we really encourage you to go and investigate and apply. We'll be making our selections by June 11th, and then we'll enter a 4-week incubation phase between June 14th and July 16th. And that incubation phase has some unique components to it, where Roche is providing mentorship, Matter provides mentorship in our network of really people throughout the ecosystem to really help advance what that value proposition is. There'll be a pitch day then, the week of July 19th, for the 8 to 12 semifinalists that are selected to share their solutions. And then a decision will be made by July 23rd around who will move to the accelerator phase. The accelerator phase itself is set between August 2nd and August 23rd. This is a very exciting time in the program where there is week-over-week engagement with the 3 to 5 finalists that will have really access to dedicated Roche mentors, really a deep set of knowledge and expertise from the Matter community, and then curriculum to really supplement and advance their pilot notions. And then the week of August 30th culminates the program with a final pitch day and really a selection of a winner. So that's the timeline that we're working to, and hope you come along with. Some of you may be wondering, am I a fit? So really, we're looking for solutions from all over the ecosystem, and it's open to startups that have some proof of concept, some evidence, product market fit. Maybe it's data, maybe you have 1 or 2 clients, maybe you have a solution, but we're really excited to see who might be a great pilot partner. So we really suggest that you submit your solution and outline, what you have and what you're hoping to have as far as a proof of concept. On our side, and Arun, feel free to jump in here, but let's talk a little bit about some of the things that we're looking for from a selection standpoint.
Yeah, thank you for that, Gina. And just to underscore for folks that might not be familiar with the process, the goal of the incubation phase, as many of you, as the seasoned entrepreneurs will know, you all are coming in with I would say fairly well-established value propositions. You may have done some work on your technology. You're on a development pathway. You've probably even done some commercial, some market work, some market studies. You've collected some evidence around the value of your solution. And during the incubation phase, the goal is to sort of bring that story forward and really start to marry that a little bit with some of the strategies and directions and capabilities that Roche will bring to the table. As far as kind of creating a shared vision of where we think of this particular solution can go and how it can fit and meet the needs of diabetes patients. So the goal of the incubation phase is really to bring your story, and we'll continue working with you to help challenge some of those assumptions, to bring our own theories and thoughts about how best that solution can fit and scale in the market. And the goal of the semifinalist presentations will be to share kind of that proposal of why you think this is a good fit with Roche and why that kind of partnership really makes sense. And then the goal of the accelerator phase, as Gina mentioned, is then to do a little bit of a deeper dive into what are some of the maybe outstanding business model risks or challenges or questions that you have, that we may have, around which we can then design a commercial pilot to really test some of those assumptions and test some of those theories. And so the whole process is really meant to get both you and us ready to do a pilot at the end of the day and test these solutions with real patients and real providers, so that we can both leave that process having answered some really tangible questions that hopefully will be valuable for both of us. So this selection criteria that you see here, as far as applications that we're accepting to the seasoned entrepreneur, I think many of you will be very familiar with a lot of these types of criteria, just as far as being very clear about the problem statement you're solving, what is your proposed value proposition, your technology, what's the business viability there. This space of diabetes and complications is definitely a crowded space. So really understanding how your solution differentiates amongst the competitive landscape is going to be really important. And to Stephen's point earlier, whatever evidence you might have to bring to the table to share that is going to be really important. What we are hoping to do is develop a long-term partnership with you. So it's really important that we understand your backgrounds, your experiences, the value that you bring to the table with regards to building these solutions and moving them forward. We really want to make sure that there's a good fit with you and your team, and really be thinking about how specifically this partnership can help advance your solution. Being very clear, I would say, about your partnership goals as well is going to be very important. What is it that you're hoping to get from this experience? What is it that you're hoping to build so that, again, we can define the right fit and also find the right experts within the organization that can help with that. So those are some of the selection criteria to keep in mind. Again, lastly, I want to just re-emphasize this one point that there's a difference between evaluation and valuation. And this program is not solely about evaluation. It's not a binary thing where we're evaluating your solution and making a decision. We are actually looking at an opportunity and trying to understand the potential of your solution, recognizing that there are going to be some gaps, recognizing that there are still going to be some questions around the solution or around the implementation. But again, that's where we want to work together with you to understand if at Roche, our capabilities and our assets can be brought to the table to help accomplish some of those goals, fill those gaps, and answer those questions. So important to share your story, but important to really understand where can Roche, where you think it can help play a role to advance your solution.
I think that's a great shift into the next slide, which is what really the benefits of participating in a challenge like this are. We know that entrepreneurs, most valuable asset oftentimes is their time, and that this is a commitment, but there certainly are a number of benefits. And maybe Arun, you can step through through each phase how that benefit pot sort of grows.
Sure. So in from the time we take in all applications, there will be a review process to select anywhere between 8 to 12 semifinalists who will then go through the incubation phase. This year, unlike last year, this year's incubation and acceleration program will be entirely virtual. Thanks to the Matter team that has a lot of experience now running virtual accelerators and programs, I think we're in good hands. But we'll spend about a month. It's a month-long incubation process. Obviously, not a full-time commitment, but there will be opportunities again to engage in some workshops, some one-on-one conversations with mentors from Roche, from Matter, and so it's a great opportunity for you to pressure test some of your assumptions. And again, we'll help bring some organizational insights, some strategic insights, and again, pressure test respectfully and push back on maybe some of your assumptions, so that we can think about a more robust and stronger story as we go forward. Really leveraging a lot of the Matter network and expertise. So as Stephen mentioned, getting feedback from providers, from payers, from other important healthcare stakeholders as part of the solution, I think can be really, really invaluable as you're building your solution. Those 8 to 12 semifinalists will make a semifinalist pitch, as we mentioned, and from that pitch, we will select 3 to 5 finalists that will advance then to the accelerator phase. And again, this is where we will sort of roll up our sleeves and start to think very strategically and tactically about a pilot proposal. And the goal of the accelerator phase is to develop then that pilot proposal to share with Roche, and to think about how that proposal will help us both answer some key questions that we have. There's a monetary prize for those that reach the finalist stage, and then from those 3 to 5 finalists, we will select sort of a winning solution to the challenge. Again, I think a good monetary prize from that as well that finalists will benefit from. Also a 1-year membership with Matter, which can be incredibly valuable. But again, hopefully you'll see the value throughout this program in terms of engaging with folks at Roche, folks at Matter, and developing some of those networks. So we encourage you to apply. Hopefully, again, this has shared some information about what it is we might be looking for. And just, yes, one correction. I know Gina said May 6th, the application closes. It's May 26th. So we have another few weeks, about 3 more weeks left for the applications. So if there are any questions, feel free to submit your questions or your email through the RDC at matter.health website. Visit the challenge page to learn a little bit more about the challenge opportunity. And we are excited and really looking forward to seeing what we get.
Well, excellent. I think we had just one question from the audience, and that was around the date, which was just clarified. That said, like Arun mentioned, please visit our challenge page to learn more. We're available for questions. And with that, we'll be concluding the program. Thank you for all of our panelists who participated, and you, Arun, as an exceptional moderator. This was an invaluable conversation, and as I said, it will be recorded. So please check back or check your email for the link to the recording of the session after the fact. And thank you for joining us today.
Thank you.